20 years with the DEA, I've never seen anything like this before.
1 year ago, News 2 began investigating Tennessee's opioid crisis.
I had two options, either kill myself or get off drugs.
Now tonight, we show you how far the state has come, from lawmakers to law enforcement.
If you're out there and you're dealing these drugs that leads to somebody's death, we're coming after you.
And pharmacists.
We are the last line of defense. I am glad that we are seeing more in the media.
It's an army of people joined together, combating Tennessee's opioid crisis.
News 2's live town hall, Tennessee's opioid crisis 1 year later, starts right now. Here's Bob Mueller and Haley Wilgus.
Hello and welcome to our News 2 Town Hall meeting. Tennessee's opioid crisis 1 year later. It was 1 year ago, Haley, that we began exploring this epidemic and its effects on Tennessee.
Tonight we examine the progress that has been made during the past 12 months and the plans for the future.
Joining us tonight, our panel of experts, Republican Senator and pharmacist Farrell Hale of Gallatin, who is not only supporting Governor's $30 million opioid program, but he is also carrying it through the legislature as well. TBI Assistant Director of Drug Investigation Direct Division, TJ Jordan, and Democratic Caucus Chair and State Senator from Nashville, Jeff Yarborough, who is backing a Democratic call for $250 million to be spent on the opioid crisis. Gentlemen, thank you very much for your time.
Now, Bob mentioned Governor Haslam's plan, $30 million plan. So, Senator Hale, we want to know how exactly would this address the opioid epidemic here in Tennessee?
Well, we're addressing this three different ways. We're addressing it with treatment, with prevention, and with law enforcement. And the governor's asked me to carry the prevention piece of this legislation. And so we passed that through the Senate Health Committee yesterday. And the purpose of this is to stop the new folks going in. What we're trying to do is prevent the pipeline, shut the pipeline off, put speed bumps on the road to addiction, and we feel like that we can do that. And so that's the plan that we're looking for, and so that's where we are with that.
Aiden Jordan, a lot of specifics about this plan, but you're on the front line of this war, and it really is a war out there. We've been looking at this for a year. You've been dealing with it a lot longer than that. You have help. You have these gentlemen. You have law enforcement officers. Is it getting better? Are we winning this war?
I'd like to say yes, but the answer to that question is no. It is an absolute crisis. It has gotten worse, unfortunately. And the way that you can quantify that, quite frankly, is the body count, the death, the tragedy, the tragic implications that we're still seeing.
You were telling me we're losing 5 people a day or more.
Absolutely. I mean, this is mass casualty situation. I mean, not to speak lightly of any type of tragedy in an active shooter situation, but you'll have to understand we're having a mass death incident every day in this country as it relates to the opioid crisis.
Now, Senator Yarborough, you and your fellow Democrats, you feel like this governor's $30 million plan, it does not go far enough. You all are recommending $250 million. That's a lot more than $30 million. So where would you see that extra money going?
Well, it's a lot more, but I think it's absolutely essential. Agent Jordan is absolutely correct. We are losing more people in Tennessee every year to opiates than we are to gun incidents, to automobile accidents, and the money that's in the current governor's plan that's allocated for treatment, about $14 million. I mean, I hate to be unkind about it, but that's less than a local private school just spent on their new tennis court complex. That's going to add about 2,000 people to treatment max. We had 20,000 overdoses last year. We have 100,000 people that need treatment. There's ways, we have money in our rainy day fund, but also we have numerous ways to go to use waivers through Medicaid to expand that treatment. And I think the governor's plan does a good job of taking off the on-ramp, but if we don't have an off-ramp, it's just going to lead to more black market use, and I'm afraid more arrests and more deaths.
Senator Hale, is there an opportunity for more money to be spent on this issue? And really, I want to hear your insight. You're a pharmacist. You know the addictive nature of these drugs. How can pharmaceutical companies help this addiction?
Well, I'd like to go back and talk a little bit about how we got here, if we can take a few minutes to do that. When I graduated from pharmacy school, the medical community was taught to treat pain. In the late 80s, early 90s, that changed. The medical community was taught to prevent pain. And so as that proceeded on, you look down the road, that's the first thing that took place. The second thing was that there was pain was considered the fifth vital sign in our emergency rooms. And so a patient was asked, what's your pain level, and let's make sure we get that treated. And so the physicians were encouraged and directed to be sure and to take care of that pain, and so they overprescribed for that. The third thing that really was critical that took place was the drug manufacturer said, this is not addicting, prescribe all you want. And you put those three together, and 25 to 30 years later, you can expect to be where we are now. And so this is very addicting drug, and here's the problem. As early as 30 days into this, you pull a patient off of this and they cannot tell whether that pain that's reoccurring is from the original pain or it's the pain of withdrawal. And so that's a very difficult situation to be in and very difficult to treat. Concerning the on-ramp, that's really where we can put some emphasis. We can get the most response in that. If we don't cut off that pipeline, then we're just going to keep adding, and we can do all the treatment we want to. When we talk about how much we're going to spend on treatment, we have to measure that against a lot of other things. And I signed today a budget amendment for 10 extra TBI agents, $2 million, and there's a lot of other folks asking for that money. And so how do you have to balance your budget. The one responsibility the General Assembly has is that we balance our budget every year. That's the responsibility of the General Assembly. So I agree that we need the treatment. There's no question about it. I'd like to find more money for it. But then you've got to figure out where's that money coming from? Where are you going to get that? And I push back against, as a pharmacist and independent pharmacy owner and businessman for years and years, you don't spend everything you've got. You've got to have some money in reserves. And it's been suggested that we use the rainy day fund. I disagree. I think that you have to have an overall projection on how you're going to balance your budget. And so I'd like to see $250 million in it. But we got to figure out where you're going to get $250, who you're going to cut out.
Obviously a complicated issue, and we're going to just beginning our conversation here of Tennessee's opioid crisis 1 year later. Stay with us. Our town hall meeting continues after this.
You're watching Tennessee's opioid crisis 1 year later, a live town hall.
Is we believe that the physician and the patient relationship doesn't need to be disturbed. We feel like that the practice of medicine does not need to have the government in the middle of it, trying to pick winners and losers.
Welcome back to our town hall meeting, Tennessee's opioid crisis 1 year later. You just heard from Representative Cameron Sexton, who has some concerns about Governor Haslam's opioid bill and that 5-day prescription limit specifically.
Senator Yarborough, that's obviously one of the complaints about the governor's bill. How do you solve that?
Well, I mean, I think that we would have been better off by having a much more open, transparent process that started last summer as opposed to one that started just in the middle of session. So, I mean, I think that I give lots of credit to my colleague, Senator Hale. I think that there have been a lot of people who've worked to try to round out some of the edges and solve some of the problems that were in the governor's legislation when it started. And I think we're getting towards a better work product on that part.
And what about the recommendation from the Tennessee Medical Association about adding some non-medical, sort of alternatives for pain relief? Is that something that you would see added into this bill, that insurance companies would need to cover that? Because some people say, well, they're recommending massage and yoga and biofeedback, and my insurance doesn't pay for that.
I mean, I think that look, this is a public health crisis, the likes of which we have not seen in Tennessee probably since the early 1920s. this is a massive problem. We need to change the way we're doing business. And if that means that we need to find a way to have more coverage for chiropractors, for massage, for that kind of thing, I think we should. I frankly think it's also one of those things where if you look at the data around the country, states, and I don't think my friend here will agree with me on this, but states that have medical marijuana, they have 20% fewer overdoses every year. That is a fact that's out there. And I think that if we're not going to be doing, we need to be all hands on deck to try to stop people from losing their lives and destroying our communities.
Agent Jordan, you heard Senator Hale talk about you getting 10 more TBI agents. The task force recommended 25. I'm sure you could use 50. How will 10 help? How will it not help as much as if you got 25?
Well, the good thing is I'm hearing potentially we could get 10 more, which would be 20. We are grateful and appreciative of any extra added resources that we get. Hey, you know, this is what I would consider a 3 or 4 prong approach. You've got treatment, education, and prevention, and of course enforcement. We're the enforcement side of it. You know, the condition of the condition right now is that you talk about opioids and pills and whatnot. There's another dynamic here. We're talking about fentanyl. We're talking about a drug that's much more potent, that adds extra, problems to the condition. In addition to that, we're also looking at now where we've got an influx of cocaine coming into a resurgence of cocaine coming into this country. We've got less meth labs, fortunately, in the state of Tennessee, but we've got more Mexican crystalline methamphetamine coming into the country as well. So we're kind of chasing our tail as it is. As I said earlier today, we're kind of behind the 8 ball. But certainly we are developing strategies to be able to employ or deploy these agents, whether it's 10, 20, 25. And of course, we can speak more to those strategies, but we've already started them, in fact, and would just ramp them up, provided we get the extra personnel.
And Senator Hale, how do pharmacists and doctors manage patients who do have legitimate pain, who say that these type of drugs do help them? Maybe they're a terminal cancer patient or someone who's really suffering. How do you manage that? Because some are saying, well, let's just take we need to sue the opioid makers. And others are saying, well, these help me live on a day-to-day basis. Where's the balance?
Well, we've tried to come to a balance, and there has been a lot of discussion with the medical community, the dental community, the pharmacists, all the stakeholders have been involved. And we've come what I would call to a sweet spot on this. It's not as conservative as the governor's initial recommendation was, but we've tried to listen to everyone that had something to say and to address that. And what we've done is we've looked at the data that we have from the CDC that tells us where it ramps up. After so many days, then there's a higher percentage chance of addiction taking place. And that's at 10 days, 31 days, and then also second prescriptions bring on more. And then there's a statistic that's really chilling. And that is up to 80% of our teenagers begin their addiction out of the family medicine cabinet. And that's where the parent has been prescribed 40, 50, 80 tablets. They take 6 and put the rest in the cabinet. So we've tried to address that on short term with 3-day prescription, 10-day prescriptions, 20-day prescriptions, 30-day prescriptions. And it ramps up each time. There's a speed bump where the physician is going to have to look at these issues and do some more documentation on that.
What we are learning is it's obviously a complicated problem. Stay with us. Our town hall meeting on this issue continues after this.
You're watching Tennessee's opioid crisis 1 year later, a live town hall.